Hi guys, this is Dr. Mirrafati from Mira Aesthetics. Today I want to share with you something really interesting. We have a young guy in his early 30s who had some trauma and issues and basically ended up with having stricture or scar tissue buildup around his penis. Now, with the result of that, he can't have an erection. And we tried just doing PRP, and then I did one session of autologous stem cell where we got some stem cell from his fat and converted into stem cell, injected it, and it was promising. And he started having some feeling and a little bit of erection, not to a degree that he likes or what he had. So we decided to combine all the growth factor, everything we know, to inject in his penis, obviously, and to see if that produces some activation or regeneration of some of the lost nerve, and hopefully we can get back the full erection, at least 80% of what erection he had. I think it's way too young for him to go through this, and if we can help him out, that would be a game changer. So what I've done is that first of all, I got his blood, and we converted the blood, and this is for his right side because remember, a penis have the right side shaft and the left side shaft, and what we call the cavernosum, and we injected around the cavernosum. It's what causes a person to have an erection. So that scar tissue doesn't allow the blood vessel to come to this cavernosum. So we're gonna regenerate that cavernosum and hopefully break down some of those scar tissue so we have normal circulation going. So we drew his blood, and from this, we this is for his one side of the penis. This is the liquid phase of concentrated growth factor, okay? So this is a combination of his PRP, which is platelet-rich plasma, and then CD34+, which is all the concentrated growth factor. I think in the next video, I'm actually going to show the division and explain it more in detail. But for now, just this is the growth factor, CD34, which is a 34 growth factor involved in this, as well as platelet-rich plasma for regeneration. So, and then what I decided to do this is what we call the activated fibrin gel. So, and I added CD34, which is a growth factor in this. And you can see this is like a gel form. This is a liquid form. This is a gel form. You can use that for fillers, what have you. What this does, it provides a matrix, okay? So it's a matrix, so it holds the growth factor at one place. So you need a regenerative power in one place. So when we're injecting this also has a growth factor. This is a fibrin gel. This is the platelet poor plasma that was heated up to 75 degrees, and it becomes like a gel form. So it's almost like a gel fibrin sheet like this. So when the growth factor inside of it, it doesn't allow it to kind of dissipate and go different areas, and it stays in one localized place for regeneration and cell growth, okay? So this is the activated fibrin gel. This is that liquid phase growth factor, what we call this PRP and CD34. Now, the interesting thing, I did order some Warton jelly stem cell. This is 10 million stem cell. Obviously, we're dividing into 5 million for each side. So he's going to get that stem cell injected in Warton jelly, which is 5 million in each side of his cavernosum, so total of 10 million. And this is interesting. This is a kind of a new product, has Exosome. Exosome is, and I will do another video on this, it's too much for me to explain in here. Basically, Exosome is the signaling factor that communicates from one cell to next cell what you want it to do. So if you will, a stem cell is the growth factor, but we need the exosome to tell it what you want this cell to do. And this is that exosome sort of signals the cell in here, the mesenchymal cell, that, hey, I need you to regenerate these cells. I need you to go in to do a regeneration on these cells, right? So exosome is the signaling that goes with stem cell. I think they go hand to hand. But there is a PhD guy from UCI that actually developed, not the exosome was developed a while back, but he developed a messenger RNA that goes into the exosome that in the cell itself can be converted to NAD. So NAD, nucleotide adenosine diphosphatase, where there's a big talk about NAD. But sometimes people say the NAD itself is a big molecule and doesn't penetrate the cell, but versus the messenger RNA can penetrate the cell and produce NAD inside, and NAD also help the regeneration factor or cell growth or healthiness of each cell. So now we have messenger RNA NAD exosome, we have stem cell, we have that liquid growth factor, PRP and CD34, and then we have the fibrin gel plus the CD34. So we're injecting all this in one time, and obviously I did advise them that we should probably do a monthly injection of this exosome, and hopefully we get it to a point that he'd be happy what he has. And we continue this in our next video as far as what we have with him, and I keep you guys posted. But for now, I'm excited to do this. I'm going to go right now back to the room and inject this, but I thought about making this video and kind of inform everybody. All right, stay blessed.